Hi, my name is Jadon and I will be performing the head to toe assessment December 2nd, 2020. Knock knock. Hi, my name is Jadon and I'll be your nurse today and I will be performing the head to toe assessment on you. Okay? I'll be right back. I just have to wash my hands. So before I turn on the sink, I would have to grab piece of paper towel, turn on the sink, making sure that the water is not too hot, not too warm, but lukewarm. I'm rinsing my hand with water and soap. Making sure that I scrub my hands, my fingertips, and between my fingers by 15 seconds to 20, singing the happy birthday song twice. Happy birthday, happy birthday, happy birthday. And then just washing my hands again, grabbing a piece of paper towel, turning off the sink. And then grab a piece of paper again and patting my hands dry. Okay, now we're going back to the patient. Hello. My name is Jadon and I will be doing your head to toe assessment. Would you mind stating your, before we do that, let me close the curtains for privacy. Would you mind telling me your name?
Lauren Wynn.
Okay, we want to make sure that the bracelet matches the patient's name again and date of birth.
10/22/1985.
Excellent. Do you know where we're, what season?
Winter.
And do you know what year we're in?
2020.
And do you know our president's name?
Joe Biden.
Excellent. Do you have any pain?
No.
From the scale of 0 being the least pain, and 10 being the worst, being the 10 being the worst. How do you rate your pain today?
No pain, 0.
Okay. And the patient has no pain, and no dull or sharp pain. Now we'll be inspecting the patient's scalp and head to see if there's any swelling or lesion or anything. Okay, so I will be donning on my gloves. So I'm checking to see if the patient has any lesion, any infestation of lice, or any swelling. And looks like there's no redness, no swelling, no abrasion, no bruises. Patient is clear of scalp. Now we will be checking the patient's eyes, and right now I will be taking off my gloves. And I'll be checking the patient's eyes. Okay, so I'm going to ask you to follow the pen. Okay.
Yes.
All right. Okay, can you pull down your eyelids, please? Pink and white. Patient has patient's pupils are round Sclerola is white and it's pink. No conjunctivitis. Patient's iris is brown. And again, I'll be checking the pupil size. And pupil size of the patient is 4. Okay, and so I'll be asking the patient to, I'll be checking the patient's, assessing the patient's ears. Now, I'll be pulling back the patient's pinna. So I'll be pulling back the patient's ears up and then back, the pinna up and back. And in the tympanic membrane, there is no drainage of mucus, and it is all clear. I'll be doing the same for the other side. No drainage. Again, I'll be pulling back the ear up and back, and there's no drainage of the tympanic membrane. Back of the ear, there's no cuts, there's no bruises. Okay, now I'll be assessing the patient's nose. And I'm gonna ask the patient to hold down one nostril and blow out. Okay, just to check the patient's cranial nerve. Okay, and patients can blow out clearly from the nostril, and looks like there is no drainage. Clear. Now I will be assessing the patient's throat, and actually I'll be assessing the patient's throat. And I'm gonna ask the patient to open up but before I open up ask them to open up their mouth. I check their lips. It is moist and pink. And I'm gonna ask the patient to say ah. And the patient's membrane is pink, and it is white and clear, and no cavities. Now I will be checking the patient's neck, and I will check to see if the patient's cranial nerves, if there's any lymph nodes. Okay. Now I can't wash my hands. I can't use hand sanitizer because I'm allergic to the alcohol. It breaks down my skin, so therefore I'll be washing my hands again. I'll be right back. Okay. Okay, so looks like the bell piece had, one more, sorry. So before I wash my hands, I'm gonna grab a piece of paper. I'm gonna turn it back on, making sure the water's lukewarm, washing the hands, scrubbing it, my fingertips and between my fingernails, and grabbing a piece of paper. To turn off the faucet, patting my hands dry. And before I do that, I'm going to use this piece so I can turn my piece on my bell correctly. Okay, so going back to the patient. Sorry, I had to wash my hands. I'll be checking the patient's lymph nodes to check if there's any swollen. So I'm gonna ask the patient to rise her head up so I can feel if there's any lymph nodes. There's no lymph nodes, all clear. And now I'll be asking the patient to move that back at a 45-degree angle. To check for patients, to assess for patients JVD. So I'm going to ask the patient to look on the left, and I will be palpating for patients if there's any lymph nodes. And on the other side, if there's any lymph nodes. And now I'll be checking to see patient's trachea. I'm going to ask the patient to lift up their heads. Okay. And patient's trachea is symmetrical, and it's not deviated. No lymph nodes. Now, before I have the patient move forward, I just want to assess the patient's cranial nerves. And I just want the patient to smile for me, frown, pop your cheek, and raise your eyebrows. Excellent. All right, so I'm going to ask you to move forward. Now I'll be assessing the patient's, palpitating the patient's back to assess to see if there's any pain. So I'll be checking the patient's back. Okay. Can you so I'll be up palpitating patient's back for any pain. Do you feel any pain? Do you feel any pain?
No. 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 No.
Okay. So patient is not feeling any of pain. Now I'll be checking the patient's I checked the patient's posteriorly and it was clear of no pain. Now I'll be checking for patient and posteriorly. I'll be listening to the patient's posteriorly of their lung sound. Okay. Breathe in, breathe out. Breathe in and breathe out. Breathe in and breathe out. Okay, so I assess for patients posteriorly for any sounds of cracking, wheezing, and patient has no sounds of cracking or wheezing on the back. Now I'll be checking the patient's heart sound. But before I do that, I have to hear the patient entirely hear their lung sound. Breathe in. Breathe in. Breathe in. Breathe in. Breathe in. Okay, so there is no sounds of cracking or wheezing again. And now I'll be assessing the patient's heart sound. And so I'm listening to the aortic valve, which is right second intercostal space, for 1 minute. And I'll be listening to the patient's pulmonic valve for 1 minute. And I'll be listening to the patient's Ebbs point, which is third intercostal space, for a full minute. And I will be listening to the patient's tricuspid, which is fourth intercostal space, for a full minute. And now I'll be listening to the patient's mitral valve, which is fifth intercostal space, and that is mid ventricular intercostal space. And S1 for lub, S2 for dub sound. And I have assessed the patient's heart sound, which is all clear. Now I'll be assessing the patient's abdominal. I'm going to ask the patient to lay down. Okay. And I will be checking for patient sound. By checking the quadrants, assessing the quadrants. So for right lower quadrant, I hear 5 to 20 clicks. For right upper quadrant, I can hear 20 clicks, which is normal. Now I'll be assessing the left quadrant points. So for the left upper quadrant, I hear 20 click sounds. Now for the left lower quadrant, I hear 20 click sound per minute. Okay, so now I have assessed the patient for no for clicks, which is normal, and at this point I'm going to ask the patient to sit up for me, and I will ask the patient to, now I'll be checking the patient's femoral legs. I'm gonna have the patients assess the patient's legs. At this point, I'm gonna ask the patient to move back a little bit to see if there's any edema on patient's leg. I'm pushing down. There's no edema. For scale is 1. Skin is clear, no bruises, no lesion. Now I will be checking the patient's pedial artery on the toe. And it is strong. Now I'm going to be checking the patient's posterior tibialis pulse. It is bound. Okay. And I'm going to ask the patient to move forward. I'm going to ask the patient to shrug for me so I can check so I'll be going on the patient's back to check for strength resistance. I'm gonna ask the patient to push up against my hands. I'm gonna ask the patient to shrug. Patient has strong resistance. And I will be checking the patient's strength of their arm. And I'm going to ask the patient to squeeze my hands. Patient has strong strength. And I'm going to ask the patient to push against my hands. Okay, and I'm going to ask the patient to push against my hands down. Patient has good strength. I'm going to check the patient's capillaries by pressing down on the fingers, and looks like the capillary is normal. No bluish sign. Capillaries are red and pink and normal. I will check for skin hydration of the patient by checking the skin turgor. And patient is well hydrated. And I will also check the patient's toes again for the capillaries. And looks like the patient's normal. And then I'll ask the patient, have they went to the bathroom, urinated? Do they have any incontinence?
No incontinence.
Urine color, what color was it?
It was clear.
It was clear. Okay. Did you have any difficulty going to the bathroom?
No.
Okay. So the patient does not have any difficulty going to the bathroom. Do you have any diarrhea, vomiting,
No.
nausea?
Nope.
Okay. Did you have any, when was your last bowel movement?
This afternoon.
This afternoon. Okay. So the patient's bowel movement, the patient's urine is clear, is fine, and normal. Right now, I'm going to ask the patient to stand up, and I'm going to ask the patient to do range of motion. Range of motion is fine. I'm going to ask the patient to go back and forth in the room. Okay, patient's gait is well balanced and normal. And I'm going to ask the patient, are you taking any other medications?
No, only vitamins.
Okay. So patient's head to toe assessment is so far went normal. Everything is normal. And that's where we're going to end. Thank you very much.